Hello, my name is Alina Rodriguez, and you're welcome on behalf of Valparaiso Blood Center to our workshop where we'll talk about blood donation campaign, Give Blood, Give Life. Let's see some of the reasons about why we should donate blood. Blood and platelets cannot be manufactured, they can only come from volunteer donors. One donation can potentially save up to 3 lives. Every 2 seconds, someone in the US needs blood. Less than 38% of the population is eligible to give blood or platelets. Donated blood expires in 5 days. Red blood cells must be used within 42 days or less. Platelets must be used within just 5 days. In your lifetime, you will likely need a transfusion of blood. 36 hours is the time it takes to naturally replace blood lost from the body. Donating blood is good for your heart. Blood shortages happen most during the holidays. How blood donations help patients. There is no substitute for blood. When a patient receives blood, it was given in advance by a generous donor. Blood transfusions is needed for women with complications of pregnancy, children with severe anemia, people with severe trauma, complex medical procedures, cancer patients, sickle cell patients, patients with chronic diseases, and burn patients. Let's read some words of a blood donor. To know that my blood, O negative blood, is literally the doctors and emergency rooms' first line of defense. It's very important for me to donate and donate on a regular basis. Claudio M. Type O negative donor. Let's check what happens to donated blood. Step 1. The donation. Your donation, test tubes and your donor record are labeled with an identical barcode label. Your donation is kept on ice before being taken to a Red Cross center or another blood center for processing. The test tubes go to the lab. Step 2. At our processing center, information about your donation is scanned into a computer database. Most whole blood donations are spun in centrifuges to separate into transfusible components: red cell, platelets, and plasma. Plasma may be processed into components such as cryoprecipitate, which helps control the risk of bleeding by helping blood to clot. Red cells and platelets are leukoreproduced, which means your white cells are removed in order to reduce the possibility of the recipient having a reaction to the transfusion, and each component is packaged as a unit, a standardized amount that doctors will use when transfusing a patient. Step 3. Testing. In parallel with Step 2, your test tubes arrive at a testing laboratory. A dozen of tests are performed to establish the blood type and test for infectious diseases. Test results are transferred electronically to the processing center within 24 hours. If a test result is positive, your donation will be discharged and you will be notified. Our test results are confidential and are only shared with the donor, except as may be required by law. Step 4. Storage. When test tubes are received, units suitable for transfusions are labeled as storage. Red cells are stored in refrigerators at 6 degrees Celsius for up to 42 days. Platelets are stored at room temperature in agitators up to 5 days. Plasma and cryo are frozen and stored in freezers up to 1 year. Step 5. Distribution. Blood is available to be shipped to hospitals 24 hours a day, 7 days a week. Hospitals typically keep some blood units on their shelves, but may call for more at any time, such as in case of a large-scale emergencies. Step 6. Transfusion. Physicians determine whether the patient requires a transfusion and, if so, which type. Blood transfusions are given to patients in a wide range of circumstances, including serious injuries such as car crash, surgeries, childbirth, anemia, blood disorders, cancer treatments, and many others. A patient suffering from an iron deficiency or anemia may receive red blood cells to increase their hemoglobin and iron levels, improving the amount of oxygen in the body. Plasma transfusions are used for patients with liver failure, severe infections, and serious burns. The blood donation process. The blood donation process from the time you arrive until the time you leave takes about an hour. The donation itself is only about 8 to 10 minutes on average. The first step is registration. We'll sign you in and go over basic eligibility. You'll be asked to show your ID, such as your driver's license. You'll read some information about donating blood. We'll ask you for your complete address. Health history. You'll answer a few questions about your health history and places you've traveled during private and confidential interview. You'll tell us about any prescriptions and/or over-the-counter medications that may be in your system. We'll check your temperature, pulse, blood pressure, and hemoglobin level. Your donation. A whole blood donation takes about 8 to 10 minutes, during which you'll be seated comfortably or lying down. We'll cleanse the area on your arm and insert a brand new sterile needle for the blood draw. This feels like a quick pinch and it's over in seconds. When approximately 450 ml of whole blood has been collected, the donation is complete and a staff person will place a bandage on your arm. And the final step is refreshments and recovery. After donating blood, you'll receive a snack and something to drink in the refreshment area. You'll leave after 10 to 15 minutes and continue your normal routine. Enjoy the feeling of accomplishment knowing that you're helping to save lives. Take a selfie or simply share your good deed with friends. It may inspire them to become blood donors. They Need You Now, Give Blood, Give Life campaign invites you to reach your nearest blood center and give the chance of life. Valparaiso Blood Center.